Have you heard the exciting news? Something big is coming your way to change how you think about menstrual health and hygiene and sexual reproductive health. That's right. Get ready for Oki. Oki is an initiative designed just for you, bringing empowering insights straight to PNG. Spread the word and be the first to experience Oki. Don't miss out. Oki PNG, supported by the Australian and PNG government and UNICEF.
Welcome to the Oki Toky radio show. As always, this is your go-to source for insightful and engaging information made just for adolescents and young adults like you on a wide range of topics. My name is Tamal, your weekly host for the Oki Toky radio show, and I am delighted to be part of your day as well. Now, before we get into our conversation for this week, we'd like to first of all thank our partners and donors for making the Oki PNG initiative and this show possible. And they are the Australian government, the PNG government, and of course UNICEF PNG for today's show. Special thanks as well to the PNG Digital ICT Cluster for being a knowledge partner. This April is a special month for Oki Toky, and that is because we are celebrating Girls in Information and Communication Technology, so ICT month. Now, every year, if you don't know, since the 8th of April 2011, the International Telecommunication Union, ITU in short, which is a United Nations agency, has marked Girls in ICT Day on the 4th Thursday of April. If all of this sounds complicated, you might be wondering what exactly ICT is. Well, if you're hearing this on the radio, that's ICT in action. If you saw a post about today's show yesterday or earlier on today on Facebook using your smartphone, that's ICT too. In fact, ICT, that is Information and Communications Technology, is all around us. It helps us to connect, to learn, and to share information every single day. For this year, 2025, the International Girls in ICT Day falls on the 24th of April. That's the fourth Thursday of the month. And with the theme, Girls in ICT for Inclusive Digital Transformation, the theme is a reminder of how important it is to get more young girls involved in technology and digital innovation. For this, we are collaborating with powerful women and girls at the PNG Digital ICT Cluster who are driving digital transformation for Papua New Guinea and the region. Now, I'd like to welcome on the Oki Toky radio show Miss Rosemary Benjamin, and she's from the Allegiance Health Ltd. Thank you for making time to come on and be part of the Oki Toky radio show. How are you feeling and how are you doing?
Thank you, Tamal. I am now delighted to be here, and thank you for having me on your Oki Toky show.
All right, we'll get into our conversation for today. Tell us a little about yourself and then the work that you do, your role, and then we can get into our topic for today.
Okay. Thank you very much, Tamal. I am from Port Moresby. I was born and raised in Port Moresby, and my parents are from the Central Province in PNG. My dad is from the Rigo district, and my mother comes from the Abao district, Arama. So I am a Port Moresby kid. Growing up, I was always curious to know about how things work, and that led me to taking up a career in technology, science and technology. And so that's been the direction that I've had. And I think as I was growing up, telephones were being introduced, and we started. When I was in high school, we started to use computers. It was just being introduced. So yeah, I've always had that curiosity growing up, and I think it comes from my dad as well. So yeah, it's been great just being able to learn from all the devices that were around me, because I grew up in the urban area. And so that led me to pursue a career in science and technology. And now I run my own business, Allegiance Health, which focuses on using health and technology. Yeah.
It's wonderful to know we have women like Miss Rosemary Benjamin in the ICT space or digital space. And we're pleased to have you. Thank you for sharing a bit about yourself. So we'll start off with the Digital ICT Cluster. What is it? If you can tell us a bit about that and its significance to especially women and girls.
Sure. The PNG Digital ICT Cluster is a not-for-profit organization, and it is a membership-driven association. So what the cluster does, in essence, is provides a platform to cultivate and encourage innovation and technology advancement in PNG. And this involves bringing together stakeholders from the public and private sector. That includes the universities and academia, so that PNG can thrive in this digital age that we're in. So in a nutshell, this is the purpose of the cluster, and there are various activities that they do to make this happen in the country. So as you know, we are now being bombarded, whether you know about technology or not, or you're educated in it or not. We're being bombarded by so much technology around us. Now people are talking about artificial intelligence, blockchain that you've probably heard about. So the cluster tries to make people understand what these are and where the relevance is and how that can lead to reaching our development goals in PNG. So using technology as a tool to develop our country and solve some of the problems that we currently have.
Thank you for that detailed explanation of what the Digital ICT Cluster is. Now, before we get into the conversation on today's topic, I'd like to address something right at the beginning. Some people might argue that, with PNG still facing challenges like poverty, these are real issues. Access to basic services, of course, infrastructure is also in the picture. Focusing on technology and digital inclusion isn't a priority. How would you respond to that? And why is it still important to talk about digital access, especially for women and girls in Papua New Guinea?
Sure, and that's a very critical question and issue. I think that we need to change the way we think about how we approach our current problems and see technology or digital access, as you have said, as a tool to reach our end goals. For example, right now in PNG, we have been struggling to solve two basic services, which we always talk about, and that the two big issues are health and education. And I would add on youth unemployment, which is part of the poverty problem, and including law and order issues. So we need to first of all, see digital access and technology as a catalyst for development. I'll give an example in terms of in our education sector. Right now we have e-learning platforms which can fill the gaps in the education system. So nowadays, and as many people know, you can educate yourself through online courses without physically being present to attend classes. And we don't have enough schools to cater for everybody. So if we can take advantage of these digital platforms, we will be able to educate our unemployed or unschooled population. So that's just one example. In health, we can now use mobile phones, send text messages, call up an ambulance, or people can now call directly either online where there's internet access. We can call directly a health worker or a physician to give you advice or to tell you where is the nearest place you can go for treatment. So we need to look at this technology as enabling tools. And now with digital banking, people in remote areas can be able to participate in income generating activities and then also in the local economy as well. So it is a tool for economic empowerment, we can say that, and education and health as well. With respect to women and girls, in the global economy, there is a term they use, a digital divide. And many women and girls are often left behind. So if we don't address embracing this digital access and tools, it could mean that half the population misses out on opportunities for education, jobs, entrepreneurship, or doing business, and just basic information. So it's not about choosing between solving poverty and promoting digital access, but we should see it as going hand in hand. They should complement each other. And this means that if we want real long-term development, we need to embrace digital inclusion, especially for women and girls, and that has to be part of the solution.
Thank you, Rosemary, for sharing some of your knowledge with us in that space and how young women and girls in Papua New Guinea can use ICT or to access information to support themselves. And of course, you mentioned other important areas as well. And I took note of some of the real challenges that we have, health and education, youth unemployment, and of course, law and order issues. And in these challenges here, you'll see most of it is the younger population in Papua New Guinea are being affected by this. These are the realities that we have. You're listening into the Okie Toky radio show on Tribe 92.3 FM. We'll take a break and then we'll come back and continue with our talk for...
Okay, let me celebrate you. Okay, let me empower you. Okay, by supporting you, be the best version of you. I am here to be a friend. I am here to help you learn. I am here to help you be the best you can.
In time blow you, on many hiding good. No doubting you, yeah. Long time, long sick moon. Now when time blow you, how mama's messed up good. No doubting you, yeah. Long time, long sick moon.
Okay, let me celebrate you. Okay, let me empower you. Okay, by supporting you, be the best version of you. I am here to be a friend. I am here to help you learn. I am here to help you be the best you can.
You're listening into the Okie Toky radio show. This is your go-to source for information on menstrual health, hygiene, and of course reproductive health as well. I've got Rosemary from the Digital ICT Cluster, and she is, I'd say, an expert in her own field as well, and she's sharing some very important information with us. Today is episode 33. And if you're listening in, we are pleased to have your company. All right, so Rosemary, today we are focusing on digital health. And so what are digital health technologies? And adding to that question, could you give examples on how technology is helping to improve healthcare access and, of course, information in PNG or in the Pacific Islands? I think you briefly mentioned some of it just a while ago, if you can elaborate on those.
Sure. So digital health technologies refer to how we apply digital tools and platforms to improve healthcare outcomes. So an example would be telemedicine, where it's not common right now in the country yet, but it's been done in other developing countries and developed countries, where you can make a video call to a doctor that you prefer, and then they can communicate through video, and you can ask questions about your symptoms, what you're going through, and then they can give you advice. So this is a platform to improve healthcare in especially rural and remote areas where there is no doctor available or no clinic or hospital nearby. So telemedicine is one application. There's also health apps, and I'm sure maybe some of our viewers already using some. So for women and girls, there are apps out there that can track your menstrual cycles. You can also track what's happening in terms of your mental health, your fitness. We now have those watch gadgets or pedometers that you can wear, wearables that they call them, where you can monitor how you're going with your health and fitness, and also chronic conditions. In the much bigger, like in the hospital and healthcare space, with healthcare providers, they use electronic health records. So as a patient comes in, you're able to store the information safely and digitally online, so that if they go overseas or they're traveling and something happens to them, they need healthcare, they can go to a doctor where they are in another country, and they will be able to still pull up those medical information, because they're in medical jargon, medical terms and all that. So it's a way for the physicians to communicate with each other, and for that data to be available in different places. We also have AI. It seems to be the buzzword today, artificial intelligence diagnostics, where you have software that are able to predict diseases faster and more accurately as they see patterns in your results. Like if you have blood tests and you've been doing annual checks, the AI will be able to predict that, maybe with the blood test, there's a lot of negatives we're seeing. Maybe in the next 6 months, you're likely to have a stroke or likely to have a heart attack. So these tools are now available, especially in developed countries, but they can be accessible in our country as well. Of course, we're aware of SMS health alerts, and I've mentioned smartwatches to track heart rate, activity, sleep, and all that. So those are examples. And these are areas that can be used by the healthcare system, and even just us individuals. It gives us information, data, so that we are more aware of our health status. And it's more common it's more common in urban areas where there is the infrastructure in place, where you have internet access. So in rural PNG, and maybe in the rural villages right across the Pacific, we're still trying to get these technologies out there, like telemedicine, e-health. Technologies like this need consistent internet access, and because you're dealing with data and a lot of data, so storage and all that. So we need the infrastructure in place. So we haven't had these technologies being tested yet in our rural villages, especially remote areas. But the use of mobile phones has been very helpful. And these are some of the solutions that can be offered at a low cost through subscriptions or free data to make healthcare accessible. Yeah.
I'm just listening to you, Rosemary, and I'm starting to realize how powerful ICT is. Of course, the usage of technology in different spaces, and how much you can achieve if you're using it correctly, and if you have the support that's there to make it happen. Toky Radio Show with Tamal and Rosemary from the Digital ICT Cluster in session. You've given us some of the options that are there that we can tap into, and of course explore how we can assist ourselves as individuals, maybe as health professionals or health institutions or hospitals, that we can utilize technology to address issues that we have. Now, if you can share some of the biggest challenges in using digital health solutions in Papua New Guinea.
Yes, and I think when you asked the question just before this, I did mention that having the critical infrastructure. So these apps are very, very good, and they work really well when you have internet. And when you have electricity, or at least some energy supply that can be able to charge your phone or whatever device that you're using to access that application. And so now, especially in rural areas, people are now turning to solar because they need to communicate, they need to charge their phones. So these are some of the challenges that we're having. We're geographically challenged because not the whole country is not connected to PNG power or electricity. So people are using solar and other avenues to make sure that they participate and be part of those, having part of the digital access. And so more people in the village are beginning to see that there are things out there that can help them. But then we need to have that critical infrastructure in place. So having internet and having electricity is one. And of course, if you need internet, you need to pay for data. So that's one thing. I believe the country, the stakeholders right now in the internet space are slowly and surely making sure that the internet costs come down. Also, there is a great lack of awareness on how these technologies can improve the lives of rural communities, and especially the apps that can make sense to women and girls, and especially women and girls who can read and write. So the literacy is very, very important. And so, for example, I have an aunt in the village. She wants to communicate on WhatsApp, with her daughter overseas, but then she needs to know how to load the data, how to press the buttons, because she's never really gone to school. So these are some of the challenges. We have women and girls that are illiterate. They see the importance, they want to be part of it, but they can't read and write and use the mobile phone for themselves. So this is one challenge I've seen in the villages where the women have never been to school. But it's working, and we just need to use, once again, digital tools to educate on literacy. So you can flip the page and also use digital tools again to increase the literacy rate in the country. So those are some of the challenges that we're seeing. Also, we need leadership who can champion this change. We need champions, and in any type of social change, there's always someone that really believes in it and rallies people alongside him or her to make sure that change takes place. So we need good leadership to champion change as well. So yeah, these are some of the challenges that we see.
Thanks, Rosemary. And exactly, you've mentioned and highlighted what we know, what we see, and a very good one as well is the difference between a girl or women in a rural setting, accessing information, than to someone like me or you in an urban setting. It's easier for us to access information to help ourselves compared to our sisters in a remote area. So yeah, I think we need to work together and to address these issues. You cannot do it alone. You need those on the ground. If we have associations, if we have agencies on the ground, we can always partner and see where we can assist to make it happen for our people. This is Okie Toky Radio Show. I appreciate your time. If you're with us, with Rosemary and myself, it's a pleasure to have you. Our topic for today is championing digital health, of course, and Rosemary is sharing what she knows with us, and I'm enjoying this conversation, learning a few things from her field as well. Rosemary, why is it important for girls in Papua New Guinea to have access to digital health tools?
Sure. I think it's very important. For me, myself, I have seen the importance of using technology. In PNG Women and Girls, we have a lot of girls who have burning questions growing up as young girls and growing into adulthood. There are just many applications that can be used in this for women and girls. And I think just having access to information about anything, And I think specifically for women and girls, there are some issues in PNG which are taboo, like to talk about. And things like menstrual cycles, puberty, things like that. So that's just one way where digital access can educate our young girls, and so that they have data and reliable information at their fingertips. And then they can be able, when you have more information and when you have more knowledge about an issue, then you are able to make a confident decision about yourself and your life. So it empowers, when you have knowledge sharing, it empowers women and girls to make good decisions for themselves. And also, we are now moving towards a digital age, and we don't want to be left behind. Now, with jobs, like right now for you, you have to be able to learn how to use a computer to be in this job, right? So it's the same. If you want to have a job, it's important that you learn to read and write, and you're able to at least learn how to use a mobile phone, a computer, or any applications that are relevant to that job. So it's empowering. Right now, employment, you can do jobs online. So girls can participate in remote jobs or do things and then get paid for it online as well. So these are, it really tries to create a safe space as well. And just having access to information is really important and empowering for girls and women as well. So it's important that they know about these tools, yeah, and use them.
This reminds me, Rosemary, of the Oki Tracker app that's available online. And that app gives valuable information on puberty, healthy lifestyles, staying safe, menstrual health, even information for girls with disabilities to access. It's for everyone. Now, with its strong data protection standards and child-friendly features, can apps like Oki help build confidence in young girls to take charge of their health?
Oh, absolutely. I think the Oki app is it's really great because I actually downloaded the Oki app myself, so I've had a look at the features. I like how there's strong data protection, so it's password protected, like you were saying. It has strong data protection standards. It has very cute interactive female characters. So I chose one called Ari, and Ari in my language means younger sister or sibling, younger brother. And so the characters talk to you, and there's like pop-ups that say, hey girls, let's support each other and things like that. So I really like the app. I think it's really creative, and the child-friendly features. So definitely, yes. I think first of all, young girls want to have a safe space where they can share questions that they have that they may not want to share in an open, like outside of their friends or family. So yes, it does create a safe space. It definitely builds confidence in young girls because they are able to access reliable information and make decisions based on that information, and they're being self-educated, which I think is empowering and very important. And they feel a sense of community because there are other girls on the apps that are sharing their questions and doubts. I'm going through this cycle, I'm having questions, are you other girls experiencing the same thing? So it creates a safe community to share experiences, so they can also interact online. So definitely, I think the Oki app is a perfect example of how it can empower young women and girls by giving them access to reliable health information and advice right at their fingertips. So, and I was just talking with Benedict from UNICEF, and she said they tried the Oki app with some of the girls from the university, UPNG, and they realized that a lot of the girls in uni, and these are girls that are above 19, that found the app really useful. And so, there are a lot of girls out there that just don't have the information, or it's just not talked about at home. So it's been really helpful, and I like it myself. So, yeah.
Oh yeah, the Oki app is amazing. If you're listening and you haven't checked it out, go on to Play Store or App Store if you're using an iPhone and check out the Oki PNG Tracker app. And of course, install it. Definitely, you'll need a password. And like Rosemary mentioned, it is you can create your own password and all that. So you access information that at your will, anytime, anywhere, as long as you have data and some connection to maybe Digicel, Vodafone, or Telecom. We'll just take a quick break and then we'll come back and we wrap our conversation with Rosemary Benjamin, who is our special guest for today's Okie Toky radio show.
Okay, let me celebrate you. Okay, let me empower you. Okay, by supporting you, be the best version of you. I am here to be a friend. I am here to help you learn. I am here to help you be the best you can.
In time blow you on many hiding good. Doubting you, yeah. Long time no sick mood. Now I'm time blow you. How mama's messed up good. Doubting you, yeah. Long time no sick mood.
Okay, let me celebrate you. Okay, let me empower you. Okay, by supporting you, be the best version of you. I am here to be a friend. I am here to help you learn. I am here to help you be the best you can.
You're listening into the Okie Toky radio show, and we are back on this side with our guest, Miss Rosemary Benjamin of the Allegiance Health Ltd, who is providing valuable inputs for this month's Special Goals in ICT Okie Toky radio episode. As always, I am pleased to have you and happy to be your host. My name is Tamal, and Rosemary is very good. Yeah, she is our inspiration for many girls who's in the ICT space and sharing experiences and expertise with us. And of course, she's from PNG Digital ICT Cluster. I've mentioned Allegiance Health Ltd is what she is attached to. Rosemary, what advice would you share with our girls who are interested in pursuing careers in digital health or related technology? And also, if you can talk about some opportunities or programs in PNG or in the Pacific region, which girls could seek out and apply for.
Sure. Girls out there listening, young girls and women, you need to believe in yourself. We must believe in ourselves that we can achieve the things that we dream about. You can achieve anything you put your mind to, and if you're willing to do what it takes to reach your goals. There are a lot of women in PNG and in the Pacific that have achieved their dreams, and they're contributing to the community and nation building, and you can do it in your own way as well. So, as girls, we in PNG, of course, a lot of cultures and societies are patrilineal or patriarchal, where the male are given the first opportunity, or they are given the, if it's a family of girls and boys, the boys get to go to school first. That was definitely my mother's experience and many people from her generation. So they had to wait for the boys to get educated, or sometimes growing up, they would be told, oh no, you don't have to go to school. You can stay back and look after your younger siblings. So women really were left out in those days. But today we are having opportunities. There's opportunities available where you can take part, be educated, and follow your dream. So I think that as long as you believe in yourself, and if you know someone else who has done it before, you can do it too. In anything, there are always challenges along the way. You will, as girls, we we tend to doubt ourselves at times. So that the self-doubt's creepy, negativity, there's always people who will be negative, but each individual in this world, you are unique and special. There is no one else like you on planet Earth, and you have a purpose to play. And if you want to pursue a career in science and technology, use it as a tool for the greater benefit of the good of others. And so you have a purpose in this world, and follow what God has placed in your heart and just go for it, and the doors will open. I really believe that. And so girls out there, believe in yourself, whatever it is that you want to do in life.
That's a very good advice from Rosemary for you and I, if you're listening in, to take on. Yes, like Rosemary said, believe in yourself. You can do this. Rosemary, we know girls face many barriers, and sometimes apart from economical barriers, there are social expectations of what a girl should do with her life. You just mentioned that, and her choices. And always that prevents girls from working on ambitious careers like a career in digital health. How can families, schools, and communities encourage young girls to explore technology and health together?
Yeah, I'm glad you asked the question because it is a very powerful topic, and I'd like to just break it down and really summarize with these points. We need to change the narrative early, just like I was saying earlier. We need to see things differently in how we try to solve our issues at home or in the country. So with families, encourage curiosity. This definitely, my dad did this with me. So I used to like to use phones, and I used to like to go to work with him where he was working, and there were microscopes and all these things. And he encouraged it. There were times he took me to work, and I was able to spend the day with him at work. So, families can encourage curiosity. Let your young girls ask questions. Let them play with the phones. I mean, well, at a certain age, of course, not babies. And, we're talking young girls reaching puberty and above. Let them learn about computers, explore biology, health topics, and without judging them. And we shouldn't place barriers. And sometimes it really starts in the house where we're like, no, girl, you're a girl, you shouldn't be doing that, or let the boy do it. We are already placing barriers in the home when we do that. So let them explore for themselves. In the community, celebrate women in health and tech fields. Invite role models to speak at events or schools, and I think the cluster does that really well. And of course, Tribe FM is doing that, and other organizations, so that other girls, they may have a dream, but they see that, oh, this lady has done it. Why don't I follow in her direction and get advice? Make it real and relatable. Show girls that technology helps people, especially in their communities. Let them see that it's not just about computer programming or coding, but beyond that, you can save lives, you can solve problems, you can help others. Schools teach digital literacy and basic coding earlier in primary and high school, and combine tech, science, and create creative projects or innovative projects. Like give a challenge, like a hackathon, like what the cluster does. Tell them, design an app that helps pregnant women in your village, or something like that, or like apps like Toky. So make it fun, make it exciting, and it shouldn't just be for the boys. Support girls emotionally. You know how we've talked about, we girls deal with a lot of self-doubt. So talk openly about it, encourage one another, have mentors to guide the girls to explore without fear of judgment. And lastly, providing that access, having the tools, internet, computers, and make it safe online spaces to learn. So when the girls see that technology is it's not just, sometimes technology is viewed negatively, but it can be a positive thing. And it's not only about learning how to code and do programming and all this tech stuff. but it can be about helping others heal. You can use it in health, in agriculture, in different ways, and change lives. So when they see that this is you can make meaning out of this technology, then they will see themselves in it. And when people are all around see that they believe in their potential, then the doors will open and opportunities will come. And I believe in that. Yeah.
Thank you, Rosemary. I'm enjoying this conversation. If you're listening in, this is the Okie Toky Radio Show, your weekly show that provides you valuable information to do with menstrual health, reproductive health, and hygiene, and other very important messages for us young Papua New Guineans, and of course for adolescents as well, growing up. Of course, that's Rosemary Benjamin. She's our special guest for today. What a powerful message, messages that Rosemary has been sharing with us. We are at the end of our conversation. Thank you, Rosemary. So to wrap up, if you can tell us, how would you like to see the theme of this year's Girls in ICT Day, which is Girls in ICT for Inclusive Digital Transformation, how would you like to see that theme in action here in Papua New Guinea?
Yeah, great question. I think we just have one message that's from me and also on behalf of the PNG Digital ICT Cluster. We need to invest in women tech founders to inspire our women and girls to become problem solvers and to contribute meaningfully using technologies to solve our everyday challenges. So this ensures that we participate in policy dialogues, get involved in the community gatherings that talk about technology or AI and how it's helping reach our education, health, and, not just national issues, but even issues in the home. And that's how we can get involved so that the girls are not left behind. They're included. We need to empower each other, teach our family members, bring it home about how to use technology properly and safely and how these tools can help enrich our lives in today's information age. And, the PNG Digital ICT Cluster runs 2 signature events, which is the Tech Innovate Conference, and it showcases our local tech innovations annually and biannually. And we have hackathons biannually as well with academia like universities and industry. So we are welcoming our young listeners and encourage our young women and girls to participate in these conferences as well. So this is how the cluster is also encouraging girls in ICT for inclusive digital access. Yeah.
Miss Rosemary, thank you so much for joining us on Tribe FM today. Very inspired by your experiences, your stories, your expertise that you've been sharing with us. And I hope that our listener is also feeling the same as I am. But before we say goodbye, could you share some contact details of the PNG Digital ICT Cluster? And if we've got the others still listening in, they can take the contacts down and maybe get in touch with you if need be.
Sure. You may contact the PNG Digital ICT Cluster on our Facebook and LinkedIn page. So just simply on the search box, just type in PNG Digital ICT Cluster and it will lead you to that page. We also have a website, so that's ICT Cluster, ICTCluster.org.pg. That's our website. You can visit our website as well for more information, or you can email us at clustermanager@ictcluster.org.pg.
And that brings us officially to the end of our Okie Toky Radio Show. The interview segment, the interview part of the show is now ending. But if you're listening in, don't go yet. We'll be back for the Okie PNG Spotlight and, of course, wrapping up our show for this week. Once again, Miss Rosemary, thank you so much for your time. Keep listening in. We'll take a break from here and release Rosemary to go, and then we'll come back and continue with our show and, of course, end it as well.
Okay, let me celebrate you. Okay, let me empower you. Okay, by supporting you, be the best version of you. I am here to be a friend. I am here to help you learn.
You're with Tamal on the Okie Toki radio show. Well, I'd like to welcome you back to the end part of the show. All right, so if you missed it, Oki is now in Papua New Guinea, and it is a globally recognized period tracking mobile app, which is used in 11 other countries apart from Papua New Guinea. And they are the Philippines, Indonesia, Ukraine. Of course, there are others as well. You can easily download the Oki PNG app on Google Play Store, like I mentioned earlier on. That's if you're using an Android phone. And if you're using an iPhone, you can check out the App Store and download the Oki app onto your phone. So once the app is being downloaded, it can be used offline. So you don't need to top up your number every time to get data. It is a one-time thing. Once it's downloaded, that's it. You have everything and you can access the information offline. And the amazing part of this is that you can share any information in there with your friends or your family or whoever, your colleagues. It's there is an encyclopedia section in there which you can extract information and share. So don't forget to always keep listening into our Okie Toki radio show every Wednesday at 2 o'clock so you can be up to speed with all the updates that always come out on the Okie Toki radio show. We also have the Oki interactive voice response service that is still yet to be put out for you and I to access, and of course the Okie Toki hotline. But for today, it was an incredible conversation we've had with Rosemary, and she is from the Allegiance Health Ltd, a member of the PNG Digital ICT Cluster, and she was talking about technology, health, and how girls and women can be a part of PNG's progress in these areas. It's amazing to have women like this talking on their experiences and what they know and share with us. With that, we've come to the end of our show, and I'd like to thank you for tuning in to the Okie Toki Radio, which is your trusted source for practical and empowering information made just for young people like you. My name is Tamal. I was your host for today, and I can't wait to have you back next time. Before we go, we'd like to thank our partners and donors for making the Oki PNG initiative and, of course, today's show possible. The Australian government, the PNG government, and UNICEF. And once again, don't forget to join us same time, same day next week for more exciting discussions on Okie Toki Radio. Until then, stay healthy, stay confident, period.
Okay, let me celebrate you. Okay, let me empower you.